million-dollar question, if you will, which is,
How might anger be treated by your
yeah,
research
how might
using
anger be
CBAT?
treated? What's the point of just giving people questionnaires and getting scores and and labeling them with diagnostics if you cannot help them? So we move on to treatment. CBAT, which you mentioned, William, stands for Cognitive Behavioral Affective Therapy. It is not CBT entirely. I mean, it overlaps a little bit with CBT, but it has got many other unique features. The cognitive, as in CBAT, is designed to change the way people think about anger, right? They're appraisals. But we in CBAT go much farther than just changing people's interpretations. We introduce many cognitive techniques in sequence, I should say. We don't just throw it out there like a smorgasbord. Our cognitive approach is also loaded with interesting and important educational information, what's called psychoeducation. We try to give people a rationale for regulating their anger effectively. There's no point trying to change their thinking if they're not motivated to do so. So psychoeducation is an important starting point. Now on to the behavioral. The behavioral component in CBAT focuses on what people do, actions. Actions speak louder than words. What's the point if they have changed their thinking and all that? They do all the thought stopping and the distraction, they get all the educational information, and in the end, they still hurt other people through passive ways or through blatant ways. So this is where behavioral therapy or behavioral modification is very useful. In fact, it's integral. What does it comprise? Signing a contract. Therapist and client collaborate in signing a contract. It's not legally binding, but the contract specifies the goals in the program. And lastly, but not least, we have the A in CBAT. That A refers to affective. Affective means related to feeling. So fundamentally, we acknowledge that we're not just going to deal with the way people think and act. We're going to recognize that they have feelings when they're angry. And these feelings may linger on and on for a long time if not addressed. So we use a lot of emotion-focused therapeutic techniques, such as what's called the Gestalt empty chair technique, right? We use written disclosure. We encourage people to confide in a trusted person about their anger, ideally to confide in a professional. We also very creatively use expressive art in the visual arts as well as in music, right? Whatever they are inclined to, because those are potentially valuable ways for people to express their anger in a safe manner.